I want to introduce myself. Most people, I think, know about me, but I've been teaching classes in natural health and macrobiotic education for over 40 years, and my website is themacrobiotic.com. And I've had a lot of experience over many years at a world-renowned macrobiotic natural health institute, the Kozinski Institute, where I was there for 27 years. The longest teacher who was there, and counseled and taught many thousands of people. And a lot of what I'm going to be talking about is based on my experience and my research that I've done with this. So today's presentation, I'm going to be talking about protect the heart, protect your heart. It's called Protect Your Heart. And heart disease is a major cause of death in the U.S. and throughout the world, even though the drugs and procedures have been somewhat effective in slowing down the disease. It's not really a cure for the disease. It's more of a symptomatic, in a sense, a way of slowing down the disease in some cases. And such things such as bypass surgery, which is an amazing procedure where they bypass blocked arteries, has the effect of basically over 10 years, the people who survive, who don't do that and do the procedure are about the same in the research they've done. Medications such as cholesterol-lowering drugs don't really work by lowering the cholesterol, as it's explained, but it has more to do with the fact that it is calming down inflammation. Unfortunately, though, the statin drugs have very bad side effects. So statin drugs are cholesterol-lowering drugs, the major cholesterol-lowering drugs. One of the major side effects of the statin drugs is basically it depletes this very important nutrient for the heart called CoQ10. And a lot of studies have been done that shows that it depletes CoQ10, and the CoQ10 is a major important element for cellular energy production in your body. So it can create deficiencies like muscle wasting, muscle pain, heart failure, neuropathy, amnesia, and cognitive dysfunction. So there are a lot better ways to get the inflammation down in the arteries. The main effect of the statin drugs is not by lowering the cholesterol, but lowering the inflammation in the arteries. And there's a lot better ways to do that with diet, supplements, and herbs. Also, things like the blood pressure medication. Blood pressure is seen as a risk for heart disease and things like strokes, high blood pressure. So blood pressure medication, though, has lots of side effects, and there are natural means to lower your blood pressure. So some of the side effects of blood pressure medication include an increase in blood sugar levels. It can occur for people with diabetes or pre-diabetes. And it can also create impotence. Some of them can create impotence. Some of them can create things like potassium loss and excessive thirst and dehydration. Others have been known to create severe infections and to slow the heart rate, also to create things like chest pain and breathing difficulty, shortness of breath, nightmares, depression, irregular heartbeat. So I just mentioned this because even though it's important to have lower blood pressure, the drugs have bad side effects. They come with other things they do besides just lowering the blood pressure. Just like the statin drugs have many side effects from the CoQ10 deficiency. High blood pressure is important to lower because it can damage and narrow the arteries, it can cause coronary artery disease, enlarged heart, can cause many problems. So definitely we want to get that under control. Now, so many side effects including the side effects from the major surgery that is done, the bypass surgery. My brother got bypass surgery 10 years before he passed from heart disease, so it didn't really help him in the long run. But one of the side effects of the bypass surgery was that he got lymphoma, cancer lymphoma. So this was something that was a side effect of that. So that's not without safety too. So there are many, many issues with the major approach, and it's not really a cure. It just slows down the progression of the disease in many cases for heart disease. So I'm going to be talking about natural ways that you can protect the heart that have been found to be very effective by natural practitioners. Myself also, I found them to be effective. So one of the main issues with heart disease is inflammation in the arteries. It's a major cause of the serious complications of heart disease, which are things like hardening in the arteries and blockage in the arteries to the heart, and eventually blockages throughout the whole body. So you can have blockages in the arteries to the neck that affect your brain function, circulation, blockages in the arteries that affect the reproductive system and cause impotence, and blockages in the legs that inhibit your movement. That's what you see in elderly people who have a lot of blockages, that they can't move very well. And what happens is when the arteries get inflamed, then they get weak. And when they get weak, they start to get sores. And when they get sores, the body will send substances to heal the damage. And one of the substances that it sends is cholesterol. So cholesterol is not the cause. It's actually a kind of a bad repair mechanism that the body uses. And then when it gets very damaged, the body will form scar tissue and plaques, which harden the arteries and then congest the arteries and clog and cut off the circulation. And these plaques are made out of calcium and other substances. So the major cause of the heart problem is usually the weakness and inflammation in the artery is the starting point, because that causes even things like blood pressure problems. Blood pressure itself is not only caused by weakness or damage to the arteries, it's also caused by the body being in a stress mode. So, for instance, if one of the wild dogs in your town ran into your house right now, everybody's blood pressure would go up, get you moving. Hopefully you don't have wild dogs in your house, but your house or your home or your neighborhood. But anyway, that blood pressure from various causes can also be raised by stress levels. So a major cause of heart problems is actually poor nutrition and lifestyle practices that weaken the body. So this can be caused by different causes. So this can be coming from an overly rich diet, such as the modern diet, which is overly rich in sugar and fats and white flour and poor quality fats, but lacking many nutrients. And this on top of stress, which people have in modern society, even before our time now of the coronavirus, stress causes the depletion of various nutrients that are really good for the heart. So major nutrients that are missing from a common modern diet that people are eating that's very rich in calories but low in nutrients include things like zinc, vitamin E, various minerals, B vitamins, vitamin C, and vitamin A. And many of these are really crucial for the heart. So the modern diet is missing many of these key nutrients because a lot of people, especially as our diet becomes, or as our income becomes less and less in society, people are poor, are filling up on things like white flour and sugar and sugary drinks, filling up on calories rather than nutrition. And what happens is this can cause a weakness in the arteries, this lack of good nutrition. The arteries become weak and they can't repair themselves because the immune system is weak. And then basically, let's see, and just taking a moment here to admit everybody else who's waiting in the waiting room. So we should be able to get people in now. I think we have more people in. So basically, then the arteries become weak, inflamed, and then easily damaged. Another major cause of excess inflammation is the very high amounts of omega-6 fats that are in the modern diet. This comes from cheap and poor quality vegetable oils, such as soy oils and safflower oil and sunflower oil and canola oil that's in processed foods. So butter is not so much in pastries anymore. It's usually some kind of cheap oils that are being used. As I mentioned, stress uses up tremendous amounts of nutrients from both diet and your lifestyle. And this is something we'll talk about here. And over time, as the body gets older, the arteries can get weak, get incredibly weak, especially as the nutrition is really bad. So here, so as the sores develop, the cholesterol is often blamed, and many people will go on low cholesterol diets with the idea that they're blaming the heart disease on cholesterol because of the simple idea that cholesterol is around the arteries. But cholesterol is really the repair substance. So blaming cholesterol for heart disease is like blaming the police for crime. They're always there. And the cholesterol is always at the scene of the damage. So it's seen as being the cause, but it's really not the cause. It's more of like a simplistic notion that is there. Okay, so here, just checking on technical things. I'm still getting used to Zoom here, so excuse me. So prevention, one of the things we can talk about before we get into some of the elements that you could do in your daily life that can help you is that getting blood tests are helpful, because if your blood sugar levels are high, often it means that the body is out of balance and it's in high stress. It's one of the causes of that. We have to find out what that is and how to lower that, because that could be a risk factor for heart problems. And it's a good idea to also check, things like inflammatory markers that show inflammation in the arteries, and also things like like cholesterol. But cholesterol goes high not when someone's basically diet is too high in cholesterol, but often it's because it is an indicator, most likely, it's an indicator that the body is in the stress mode. And when the body is in the stress mode, then the cholesterol rises. The other reason the cholesterol rises, there's several other reasons it rises. One is that the body is not converting cholesterol into hormones, and that needs to be helped and addressed. Because if cholesterol is circulating too much in the body, it can oxidize and damage the arteries. The third reason that the cholesterol could be high is that you do have damage going on in the arteries, and that has to be addressed. So getting a blood test, every year can make sure that you don't have imbalances. And there's two elements of the blood test that can directly affect the inflammation. That's B12 and folic acid, because a deficiency of either of those can cause inflammation in the arteries, damage in the arteries. So those are important reasons. Now, there's also evidence that chronic infection is a major risk factor for heart disease. And basically, so that's why it's very important to keep the immune system strong. Now, the first thing I'm going to be talking about, there's a few things that I'm going to be talking about that are important. But the first thing I'm going to be talking about, in order to keep oneself healthy and protect yourself from heart disease, it's important to eat a really balanced diet. And you can learn more about this at my website for people who are new or coming in. That's www.macrobiotic.com. When I talk about, a diet that's centered around natural foods, whole grains and vegetables, natural animal foods, or supplements to replace that. Things I talked about in recent lectures: beans, nuts, seeds, some natural sugars, natural fats. And it's important to counter the chronic infection and to make sure that you can counter inflammation, that you're eating enough food to keep your metabolism high. When eating a whole foods diet, it's important to get enough food. When people are eating a modern diet, getting basically getting enough nutrients, enough calories is not a problem because the modern diet is really high in calories, but getting enough nutrients is more of an issue. It's also really important to have in your diet enough elements that are really good for the heart, such as zinc, selenium, vitamin A, and C. And in many cases, as we get older, some of these supplements would be good to diagnose also. It's important to get these key nutrients like zinc, selenium, vitamin A, and C are particularly important for the heart, as are certain B vitamins, as well as other nutrients. So, for instance, some of this has been studied quite a bit. Like vitamin C has been found to be protective both in your diet and also in a supplement form for preventing heart disease. So it's one of the reasons why it is, from a nutritional level, is vitamin C is essential for the production of collagen, and this protects the arteries. Vitamin C is used up when you're under a lot of stress, so people have a lot of job stress or environmental stress, living in a toxic environment like in cities, or if people basically are not getting enough sleep or working too hard, you use up huge amounts of vitamin C. I think for most people, there's some good benefit of taking vitamin C, and in Europe, where they studied this, they found if people took 1,500 milligrams of vitamin C as a supplement over 10 years, they had a 50% reduced rate of death from heart disease compared to a control group not taking it. They also found that the vitamin C group also had a 50% lower death rate from any disease compared to the control group. So vitamin C, of course, is in things like lightly cooked leafy greens, lemon, sauerkraut. It's in things such as some fruit, especially lightly cooked fruit or fresh fruit. But I think there's a benefit for most people, besides getting it in your diet, which is very much missing in modern diets. People don't get enough vitamin C, is also to take a supplement. Other nutrients that are very important to protect the heart, how to protect your heart, which is what we're talking about today, is researcher Kilmer McCulley has found a positive relationship between deficiencies in folic acid, B6, and B12. That's and this has been demonstrated by other researchers. So this is one of the reasons why you want to get your folic acid and your B12 tested well. So B12 is only in natural animal foods, and as you get older, I think over 60, it's a good idea for most people to take a B12 supplement, because the blood test may not be highly effective in diagnosing B12 deficiency, especially if you eat a lot of greens. It tends to cover the deficiency up. So you want to basically take B12 after 60, at least a few times a week. And for vegans, I recommend, and vegetarians, they take B12 every day, because it's been found that vegans and vegetarians tend to be deficient in B12. The best type is a sublingual B12, and there's one called methylcobalamin. Folic acid is usually not an issue, and B6 is found in natural animal foods. Folic acid is usually not an issue if you're eating a lot of greens and certain very concentrated, like natural hormone-free liver. If people eat that, it's very high in folic acid and certain other foods. So make sure you get this in the diet. If you're not sure, you could always get this through a supplement too. Another nutrient found exclusively in animal products and organ meats is CoQ10, which basically reduces inflammation in the body, particularly in the arteries. And anybody who is deciding to make a choice of taking a statin or cholesterol-lowering drug should really be taking CoQ10. It's also anti-aging, so this is one of the things, if you can get it, I'd recommend people take it to protect your heart after 60 at least. Or if you have heart disease in the family, like myself, you might take it earlier. My father and my brother both passed away from heart disease, so it's a good thing to take at least 2 times a day. Deficiency of certain minerals, there's a doctor who pioneered nutrition in the 1950s Dr. Roger Williams, and he found that magnesium deficiency causes the calcium deposits in the arteries to develop. So if you don't have magnesium in your diet, and this is one of the nutrients that is missing in the modern diet, usually people eating natural diets, if they eat a lot of greens, they're getting a good amount of magnesium. Some people would be warranted to supplement with some magnesium too. And K2, vitamin K2 is really important to protect the heart. K2 is different than K1. Vitamin K1 is in leafy greens, but K2 is in things like natural animal foods. It's also in things like besides in natural animal foods, it's also in sauerkraut, it's in natto, it's in something called nattokinase, and it's available as a supplement where you can get K2 with something called MK4 and MK7. K2 is worthwhile supplement taking as you get older, because what happens is K2, the purpose of K2 is to keep calcium from getting in the wrong place in the body, like your arteries and your joints. So it protects the heart. And if you take calcium or vitamin D without K2, it can cause hardening in the arteries, some research has found. So you want to be able to make sure you do that. Deficiencies of also selenium are associated with that. So basically, it's really important to take or eat selenium. Selenium is only in certain foods, and for many people, selenium might be a nutrient also that you want to take. There's a kind called monomethionine. Now, this is a big topic, and we have a kind of a short time, but we'll go over more elements of this during the Q&A session that's at 2 o'clock. But I'm going to talk about a couple of other things here. So some of these are obvious, but to protect your heart, it's really important to don't smoke. I think most people know about this, but one of the things smoking does, it creates infections that affect the arteries in the lungs. The infection in the lungs goes to the arteries. It's important to exercise, but not exercise too much, because excessive exercise will lower your metabolism and put your body in a stress mode. It's also important not to exhaust yourself by working enough to give a person purpose and pay the bills, but you shouldn't exhaust yourself from work. As much as possible, avoid exposure to things like chemicals and fumes and pollution, because this will cause damage to your body and also your immune system, which will then make your arteries weaker, using up a lot of nutrients. Minimize your exposure to what's called the polyunsaturated fats, these omega-6 fats that are even in natural foods. So try not to overeat things like nuts and seeds, and minimize oils from seeds like canola and sesame oil. Better oils for health would be things like natural butter and coconut oil and some olive oil. Eat a very nutrient-dense diet, what I call a full-spectrum macrobiotic diet. You could learn about in my website. Also, it's important to, in addition to these things, it's important to basically supplement your diet in certain ways, especially if you are older or have a risk factor. And I also recommend that people do things like have a balanced lifestyle, like to get your body out of stress, things like having we talked about this in recent lectures for immunity, but immunity also plays a big role in it also will play a big role in being able to repair your arteries. So if your body goes in stress and your immune system is not functioning well, then basically it's really important to keep your body out of the stress mode through your lifestyle. Exercises that calm the body and get your body out of the stress mode, and train your body to be out of the stress mode, such as Qigong and gentle yoga and meditation and breathing, are really important. And in addition, what we want to do is also, in addition to these things, it's important to learn about your condition. So As we get older, there are some other issues that relate to your body getting into the stress mode and also having more damage to your arteries. So one of the things I do in my full spectrum macrobiotic counseling is I use some techniques that are combining Oriental diagnosis with modern biology. I call IDX Diagnosis, to look at the condition of the heart. And the condition of the heart can be seen by looking at the face and the body, looking at pressure points, and then to see if special things are needed to focus on to help a person. As a person gets older, there are special things that I recommend on a case-by-case basis, which basically include things like special supplements. There are special degrees of supplements that I learned about in the last couple of years that will dissolve blood clots. And these supplements basically work better than a lot of pharmaceutical medicines without side effects. And as we get in 60, 70, 80, what happens is it's very easy for the body to start to develop clots that need to be dissolved. We also, as we get older, we start to develop some kind of cellular debris which clogs the arteries and blocks arteries because the arteries get damaged. So along with nutrients that protect the arteries from getting damaged, there's ways to unblock the arteries. Linus Pauling, the famous scientist who popularized the taking of vitamin C, came up with a protocol to unblock blocked arteries with natural means. His protocol has been found to be very effective. It takes about 6 to 12 months. So there are signs that I could see besides medical testing, which I recommend people get for diagnosis purposes, which can unblock arteries, unblock clots, repair damage to arteries. And I recommend that on a case-by-case basis for healing. I recommend people learn about their condition by coming to see me, but also by studying classes. So the classes I teach, diagnosis and nutrition health coach training and audio and video, is a lot focusing on how to understand your own condition so you can make changes within diet, within lifestyle, exercise, acupressure points. All of these things are very particular for the heart, depending on your condition, which you can focus on or learn about. So this gives a bit overview, kind of like in our short mini class here, about how to protect your heart. Hello, this is the question and answer period from the presentation I just gave, Protect Your Heart. Get started. So do you have any questions from what we talked about? I'm going to also add some information in that we didn't get to, because the lecture was pretty short when I answer the questions too.
I've got a question, John.
Sure.
Okay. Nice to see you. You haven't aged in 20 years since I last met you back at Kushi. So I don't know. You definitely are practicing what you're preaching. What I wanted to ask you is, someone who has already had a stent automatically gets put on these very powerful blood thinners. Can you recommend, or what would be your recommendations to assist them in building their blood, without jeopardizing, that 1 foot in natural, 1 foot in allopathic approach that's about as much as they're willing to do?
Sure. Well, one of the things that can be done is that there are some natural blood thinners, and they usually test how the blood is thinning. And there's some foods and there's some supplements that are natural blood thinners, but without side effects. So if they're done, often a person can reduce their blood thinners. They may even be able to get off them sometime because their blood is thinning enough. So one of them is vitamin E. I recommend a type of vitamin E called Unique E. That is helpful. And they would have to start with a smaller amount. You always start with a small amount if they have high blood pressure too. You have to start with a small amount and gradually build up. And these brothers who studied vitamin E from Canada were both doctors, medical doctors, the Shute brothers, Shute. They used vitamin E to cure lots of heart problems, heart-related issues. And it's a natural blood thinner, but it can be used to help. And there's a way that medicine measures how a blood thinner is working. And if it's find that their blood thinner is thinning more, then they could reduce the medicine, which usually has side effects anyway. The other one is called nattokinase. It's derived from natto. It's a natural blood thinner. It's also used to get rid of clots in the body very effectively. You can read about it. It's derived from the Japanese food natto, which has a very unusual taste and texture for most people. So it's hard for people to have it. But what you want to do is, look into that. And then basically, those are two things that you could do. Other foods that are natural blood thinners are ginger and garlic. So those would be things to incorporate so that they could not have the effect. Now, blood thinners have a lot of different effects. To tell you how to counter the effects, you look at the side effects of the blood thinner, and that will tell you what parts of the body it's being affected and what parts of the body you have to protect, and look at some natural means to help protect those parts.
Very good. Thank you.
Okay, you're welcome. Any other questions?
Hi, I have a question, John.
Oh,
Hi, can you hear me now?
Yes, I hear you.
It's good to see you. So we have a question. Vitamin B12, how much should we take, and can you take too much? I heard it could be toxic.
I think that's misunderstood about the toxicity. The toxicity arises, what happens when people have certain kinds of conditions, the B12 levels go up. So it's not toxic by taking it. It's that the B12 levels are seen as a marker for health problems when you have like liver disease and certain kinds of cancers. But it's not B12 that's causing that to go up. It's the condition that's doing it. So the B12 is, not something that will, from what I've read with the research, it's not B12 that's causing it. It's the condition that's making the marker go up in the blood. So I think that it depends on the person. Like if you, it's hard to diagnose a deficiency, but if basically it's hard to diagnose a deficiency, but what you can do is you can, a common amount for deficiencies to take 5,000 micrograms a day sublingually. But if someone can experiment with that and take as little as 1,000 or take it a few times a week, and usually if you need it, you'll notice that you have an effect from it. You'll feel different when you take it than you don't take it. The only way to really diagnose it, the best way of diagnosing it is not by a blood test. If you're deficient in a blood test, you're probably super deficient because it doesn't show up very well on blood tests all the time, especially if you take a lot of greens or green drinks. Folic acid kind of gives you a false positive. A urine test is more efficient. And then the best way also is by symptoms. If people have various kinds of symptoms, they might diagnose by symptoms. It's just good to take it a few times a week, and if a person needs it more than that, you could experiment with how you feel.
So how should you feel if you have enough B12 in you versus if you don't have enough?
Well, anybody who's vegetarian or vegan, I would recommend taking B12 supplements every day anyway, even if you don't feel anything, because there's none in vegetarian foods. The B12 that's in vegetarian foods is called an analog. It competes with B12, but it's not real B12 unless the food's fortified. And mostly the fortification would be not enough. So people could feel tired. if you get a blood test and you find like your blood marker is below 700, that's how it's measured, then you're probably deficient, if you're severely lower.
Okay. But you would feel a lot more energy if you had enough in your system than if you didn't.
Yes.
Okay. The one other question I just have for you quickly is, what liver supplements would you recommend? We eat liver once a week, chicken liver, organic when we can. We can get it at Whole Foods when they have it. So when we don't, what supplement would you recommend as a liver supplement?
Well, liver is very high in B12 and it's also very high in A. So people could take either a good cod oil or they could take sardines if they eat those, are high in vitamin A. And you could take some vitamin A supplements too. There's some you can take. If you take a vitamin A supplement, you need to take it with vitamin D and K2. They kind of balance each other.
With B and K2, okay.
Yes.
So there's not a liver supplement itself.
Well, there is a liver supplement if you don't want to take liver. There's one made from concentrated from grass-fed animals you can get from New Zealand. If any supplement you had a hard time getting, you could always contact me because I have some sources for those.
Okay. All right, then maybe we'll do that. Thank you so much for doing this.
Okay, so I think, let me just see if I can hear.
John?
Oh, okay, because the people can raise their hands too. I guess people have their hands.
Oh.
Realize that, so.
Here we are. Hi, John. Alan?
Hi, Alan.
Selenium, you said it was only in certain foods, and we haven't taken selenium supplements for a while, so.
So for most people, I do recommend that people take a high-potency multivitamin, and usually a high-potency multi will have selenium in it.
Okay.
Enough. People will take Brazil nuts for selenium, but the amount is pretty small, so it's pretty high. It's in some kind of natural animal foods, but it's hard to get enough. I think it's in garlic too. Garlic is a source of that, but depends on the soil where it's grown. So garlic could be a good food source. Brazil nuts could be, but I recommend most people after a certain age, or at least, should be taking a high potency multivitamin. And some people need extra selenium if they're healing or sick.
Okay. Thank you.
Okay, thanks. Okay, I think Mickey, has had a question. Trying to see if. Okay, I think Mickey had a question.
Yes, can you hear me?
Yes, I see you. I hear you.
Okay. John, thank you so much anyway. My question is, you recommended vitamin K2 with the vitamin D3 and the calcium, right?
Yes.
Does it mean we should eat exactly together, both together? Or it's okay with, those nutrition exist within 12 to 24 hours in our body? Either, different timing.
Sure. Well, if you have a supplement, you could just take it in the day. Mm-hmm. If you're taking a D, it's important to take K and at least get vitamin A rich foods. Or a lot of times when people are taking a vitamin A supplement, like for instance, if someone took say 5,000 IU of D, they need about 5 times as much A, which can be gotten from a food like liver, or it could be gotten from sardines. Mm-hmm. But when you take D, it's important to take K2 because there's evidence that if you take D alone, it could create calcium in the arteries.
So together.
But in the day is good. Yes, in the day.
Oh, in a day. Okay. And then also, what's the required daily amount of dosage of the vitamin K2?
Well, it's variable. It's not. It's very small amounts. So, for instance, if someone's getting out in the sun and they're eating vitamin A rich foods, they may not need to take a supplement, or as long as they're eating K2 foods, they don't need to take a supplement. If you're in the winter, it might be good to take something like that. So the amount is very, very small. It's like something like for like 5,000 IU of D, it's 1,000 micrograms of K2. So not a lot, but it's harmful to take more K2. So some people will take more K2 supplements. Some people will use it as a way of decalcifying arteries and joints and arthritis.
Okay, thank you so much. Thank you.
Okay, you're welcome. Let's see, we have, I think, anyone else, just please jump in and unmute.
Sure. This is Vicky. I thought I had my hand raised. 2 questions. John, you had mentioned something about a liquid dissolving the fats. Is that something you have on your website?
Well, there was a protocol for dissolving hardened arteries. That's what I was talking about. And it's called the Linus Pauling protocol.
Okay.
And it's a combination of 2 or 3 nutrients. Linus Paul's, it was vitamin C and lysine, taking it as a supplement. And you could look it up on the web, looking at the Linus Pauling protocol.
Okay.
For hardened arteries. And some people have also added in proline. And you could read about it. It's been quite effective. It takes about 2 minutes, though.
Okay, great. I will do that. One second question. On damp, humid days like today, at least here in DC, when you feel lethargic and even headachy, is that a heart sign or sinus or?
It usually indicates that what happens on those dark days is that the is flooded with negative ions. And because of that, it makes you sleepy, especially if your sympathetic nervous system is not working well, if you've been under stress. So that's usually an indicator of a stress response.
Okay.
More than anything else.
Besides reducing the stress, do you recommend something else?
Well, it could be a sign of low metabolism. So, that's something to look at. Like, for instance, it could be related to thyroid health. Thyroid health is related to heart issues too. And vitamin A plays a big role, but there's really it's really hard to get vitamin A from vegetable foods because the conversion is difficult. It's only in natural animal foods. It's in things like, it's in natural liver, it's in sardines, and some people can take a supplement if they can't eat those foods. You have to take the A with a D and a K2. There's kind of a balance.
Okay, great. Thank you so much.
Okay, you're welcome. Okay,
Hi, John.
Yes.
Can you hear me?
Yes, I can. Yes.
Hi, I hope you're doing well. I raised my hand, but I'll just ask the question here. Could you speak about like homocysteine interaction with heart? My understanding is it can damage, I don't know what parts of the heart or how that would play out and what's considered a high homocysteine in your opinion, but could you speak?
Well, it damages the arteries, I've understood, and that the high amount would be, the blood tests are pretty good for finding the high amount. But often what I look at when I look at the homocysteine is I look at, usually there's a B12 deficiency or a folic acid deficiency. And because that's the main nutrients that lowers the homocysteine. So for vegetarians, often it will be, but a lot of times people eating meat are not really, what's happening is they're not really absorbing the B12 now because their digestion is poor. So it could be sometimes someone eating a heavy meat diet could be B12 deficient. So it's hard to test that, but it would be good to, to do one or the other,
Yeah, and then I had one other question, which is I've heard of like the leaflets of a heart potentially getting damaged by bacteria or infection. Is there truth to that? And like, once if there is damage, is it over, or there are ways to kind of bring integrity back to the leaflets or elements of the heart, the more sensitive elements like that?
Well, there's a lot of different protocols that natural health practitioners have been using for 50 years to repair damage to the heart. And so there's certain kinds of amino acids that basically help. One of them is arginine that's used for that. So heart can be repaired, and it can be, but it really depends on the extent of the damage, I think. That's what we'd have to look at. In IDX Diagnosis, you could see that by different things. One is swelling on the nose. When the damage gets worse, you get swelling on the fingers, and then if it gets very bad, swelling on the toes and legs. So, but there's other ways I look to see it too.
Okay, thank you very much.
Okay, you're welcome. Okay,
Oh,
so,
hey, John. Can you hear
hi,
me? This is
Adrian.
Hi.
I just wanted to ask, before you ask your question, I just wanted to ask people if you're not muted, just to ask people to mute because we're getting some background noise. So thank you very much for doing that. So sorry, go ahead, Adrian.
Oh, hi. Yeah, what type of magnesium do you recommend?
Well, there's a
choline.
few different types. One, magnesium orotate, is supposedly very absorbable, according to what I've seen, called magnesium orotate.
This starts with an O?
Yes, ORO, orotate.
Okay. Also, if I take a fermented cod liver oil, should I still take a D3 and an A and the K2 also later in the day?
Well, I'd recommend the K2 because there's no K2 in there. That's reasons why some of the companies, like there's a company called Green Pastures, they make a butter cod liver oil.
Right.
And the reason they make that is because the butter from grass-fed animals is very high in vitamin K2.
Okay.
So natural sources of vitamin K2 is any kind of dairy products from grass-fed animals, including butter. And that's why they use the butter, they call it a high vitamin butter oil. And Weston Price, who researched that first, he called it factor X in the butter.
Mm-hmm.
He hadn't discovered vitamin K2 yet. Okay. So, but now we know it's vitamin K2.
Okay. The last question, you mentioned something about cellular debris. Is that considered the same thing as blood clots? Cellular debris?
No, there's other things that can go into the arteries. You could get, some things like scarring and inflammation and congestion in the arteries, and because arteries can get damaged even without having serious heart disease, and it can get congested and clogged. So there are some substances that unblock that I might use with some people, but it depends on their overall health, because first I'll work on improving their overall health before I recommend those things.
Okay. Okay, thank you very much.
Okay, you're welcome. Okay, just please jump in with any questions, and so we can unmute yourself, and then just ask everybody to mute themselves after they're done. You can unmute yourself.
John?
Yes.
Just real quick on the factor A butter with the cod liver oil. If you're having good quality butter, it's not necessary to have them together, is it? Is there a purpose to have them together at the same time?
No. It's not necessary to have it in the day. Your body will use it because these are basically D, A, E, and K are all fat soluble. So they store somewhat in the body, although, there's evidence that you should, take, you could use some every day, but you don't have to take it at the same time.
Okay, great. Thank you.
Okay, you're welcome. Okay, any other questions? Please just jump in because I'm not sure if I know how to do the raised hand.
Hi, John. It's Joan.
Hi, Joan.
Question back to the butter. For buying pastured or cultured butter, when you heat it, if you're cooking with it, does that kill the good enzymes and bacteria? Or should I always just use it just melted over foods?
Well, it depends on the culture. It depends on how you digest it. If you don't digest it well, then definitely have it over foods is better. But if you digest it well, both ways can be used.
Okay. Thank you.
Okay, you're welcome. Okay, so just please, any other questions?
Hi, John. This is Vicki. I just looked up green pastures butter cod liver. It looks like it's an oil. Is that right? Or are you saying it's a butter?
But it's a combination of, they call it butter oil. I think they created it a little bit.
Okay, great.
And so that's where you have the factor X, what Weston Price called factor X, which is basically vitamin K2, I believe. A lot of people think it's vitamin K2.
Excellent. And how do you eat it? Do you just put it in a salad or over toast or something?
Usually when people take that cod oil or they take the cod oil, high vitamin butter oil, they just take it.
Drink it and maybe...
I guess if someone didn't like the flavor, they could mix it with something, but you don't want to heat it.
It's like a gel. It's not really liquid. It's more like a gel.
It's thick, because of the butter, right?
Spoon it.
Spoon it, yes, spoon it. Yeah, thank you.
Okay, thanks.
Okay, any other questions or looking for questions? I can have some other information I have here too. So we'll go with questions first.
On that magnesium orotate, do you recommend a specific vendor?
Not specific. There's some good quality companies that are very good out there. Like Now brand tends to be good quality, and Arrow is good. Companies that are good. If you any difficulty having it, getting it, you could always contact me because I have a place that I recommend.
Okay, great.
Okay. Any other questions? If you'd just jump in with questions. Otherwise, I might add something in.
So, John, the Neuromag is not one you recommend anymore. Is that true?
Neuromag, that's a good question. Neuromag is a different type of magnesium. It's more specific to the brain than the heart.
Okay.
The Neuromag is a type of magnesium that is very specifically good for the brain. And there are other types of magnesiums that people sometimes can get. You have to be careful the amount of magnesium. Magnesium generally affects the bowels, most of the magnesium sources, so you have to be careful the amount. Most people take either 200 to 400 a day if they're not super deficient.
Okay, thank you.
John?
Yes.
Question? Yes, John, good to see you.
Yeah,
John, do you recommend any heart-healthy desserts for this pandemic time when we're feeling a little stressed?
Yes. Well, it just depends. The heart healthy desserts. Natural sugars themselves are not bad for the heart unless you have some kind of conditions. People could make a variety of desserts. It depends on how your general eating is. If you're more vegetarian, if you're more vegan, then you would do different types of desserts. But I can't recommend anything specific. It depends on how good you are at, I think, cooking. Fortunate that my daughter's a good baker, so we've been enjoying some good desserts that way. So I don't have anything. I'm not sure about specifics, but if you wanted something simple, a vegan dessert is there's a couple of old standbys. One of them is a pudding that's made from grain coffee, and it's thickened with agar, and also has in it either maple syrup or rice syrup, and also tahini. So that's more of a vegan dessert. While a non-vegetarian dessert is you could make your own Jell-O with a healthy grass-fed gelatin powder and fruit juice.
Nice.
And basically, if you wanted to make your own, anyone who eats dairy products, you could get a grass-fed cream and make your own whipped cream that's sweetened, have on that. So it'd be satisfying but simple without being too hard to digest, either one of them.
Thank you, John. Awesome.
Okay, you're welcome. Okay, any other questions? Just please jump in. I'm still learning about this raising your hand type of. Okay, well, while you're waiting, if questions come up, while you're waiting for that, one of the things that just was talked about is that a lot of pathogens I was talking about in the lecture are related with chronic heart disease, because they find in the lesions, when people die, there's lesions in the arteries, they have viruses and bacteria there. And pathogens have been around since people have been around, but it's only a compromised immune system that can't deal with pathogens. That's something we talked about during the Corona lecture, that it's really your immune system that helps you deal with this. So a healthy immune system depends on an array of nutrients, but some of the big ones are vitamin A, zinc, vitamin C, and there's not a lot of good vegetarian sources of vitamin C. Pumpkin oil is one of the better ones of that. It's also in things like oysters, and also grass-fed red meat for people who are eating meats. So those are high sources of zinc. Vitamin A is in the form of carotene in vegetable foods, is not that absorbable. To make it more absorbable, it's important to have it with a certain amount of oil or fats, whether it be olive oil or butter. That would be important to help you absorb as much. But if someone's open to eating fish, things like sardines, if you're not open to eating fish, most of the vitamin A is derived from fish. If you don't like sardines, some people don't like that taste. You could take vitamin A as a supplement, but as I mentioned before, you have to take it with D and K2. Metabolism is also another factor that's very much related to the health of the heart and circulatory system, and thyroid insufficiency is connected to that. So, and also nutrients like vitamin A and vitamin C play a key role. And you have to have a certain amount of fat in your diet and eat a certain amount of calories in your diet to keep your metabolism high, as well as a nutrient-rich diet. Okay, so before we finish up, I have time maybe for a simple question. I have about a minute before the meeting ends on me. Just want to see if you have any other questions. So thank you very much for attending the question and answer period during this time when I can't give lectures in person, although I think this reaches out to I'm very happy that I'm reaching out to people that are